Can you guys introduce mommy?
Spill the beans with Dr. Jill.
Hi, everyone. Thank you for joining on today's episode of Spill the Beans with Dr. Jill. As always, I'm going to have my guests introduce themselves, and then I'm going to talk a little bit about why I brought this person on. So the floor is yours.
Hello, my name is Colin Bassett. I would say no relation, but there is a relation. Jill's my cousin, and I've known her all my life. Um, and she invited me on to her podcast today because my experiences in pre-hospital emergency medicine specifically. I have been in EMS since about 2007. Working in ambulance as an EMT, and then later as a paramedic for the past probably 12 to 13 years. And currently, I do my role is mostly administrative, as running an agency. Um, but I still do get out on the road and still keep my skills sharp. And I think prior to that, I did work in the mental health field in a city in Massachusetts as a a multi-service agency, and I was a therapeutic mentor, so bachelor's level, um, and worked with primarily kids with ADHD, opposition defiant disorder. So prior to branching back into EMS, it was a choice of my career paths to stay in the mental health field fully or come back into EMS, which I did, but I still brought my, kind of passion for mental health and well-being of people and providers, not necessarily just patients and people we interact with.
Thank you, Colin, for being here and accepting my invitation. It's very rare that I get to talk with like family about the intersection of my research, which, as you know, is about vicarious trauma. In season two, I have been working with medical professionals to talk about in the helping profession that you have elected into. When you started many, many years ago, did anyone ever talk to you about vicarious trauma?
No.
Did they talk to you about self-care?
So we do, and this is, not to besmirch the industry that I'm in, but when you take an EMT class or a paramedic program, it's like one of the first chapters you get is the well-being of provider.
Mm,
Um, and when you get to, eat right,
yeah.
avoid caffeine, avoid nicotine, get sleep.
Mm,
And when you're working a job that sometimes has 24-hour shifts, it's like, yeah, everybody, everybody knows what you're supposed to do, but
hmm.
just saying, do these things in a job that makes it very difficult to actually do these things. So it does exist in that sense, initially, like, the warning.
Hmm. Have you met or seen employees, colleagues, peers that you feel are burnt out and they're still working?
I yeah, definitely, like, absolutely. And I mean, burnout is real. And I think I probably got pretty close to it at some point. And, I've been in higher levels of management for almost 10 years now. So I have maybe a unique theory on burnout in our profession. I mean, there's definitely, I think it's different because you have people that can go to two different people going to the same tragic call,
Yep.
and one of those people is okay,
Hmm.
and they're going to process it, they're going to move on. But then you have another person that isn't,
Hmm.
and it's not always easy to pinpoint what tools that person got to let them to be able to process that. Was that
Hmm.
recent? Was that, did that start the day they came home from the hospital with their parents that they were given those tools?
Right.
For me, it's my own personal journey through therapy. So whenever I teach a class or talk about this, I inevitably get asked by the students, "What's the worst call you've ever seen?"
Oh,
And
I
my
hate
answer,
that answer. I hate
so
that question.
well, I've got a great I have
Yeah.
like the best answer for that I've started using. It's like, well, I haven't seen it yet.
Oh, I love
Like
that.
I haven't gotten to the call that I will go on that the call that I go on that I'm not going to be able to like process and work through and then continue to do my job. That will be the worst call. And I've
Right.
seen terrible things, but I have not gotten there yet.
It's crazy you're saying this because, as we do these podcasts, it's not rehearsed. There is no script. It's just you and I talking. In a previous episode, I talked about how my biggest pet peeve in higher ed is when we ask practitioners in the interview process, what was the worst scenario that you dealt with? And my recommendation to higher ed is stop asking that question because re-traumatizing and reliving that does not mean you're going to be a better employee than somebody else, but I think what they're trying to measure is their resiliency. What do you know about yourself that you would need other professional development on? Or where can you step ahead and say, this was really difficult, but I persevered. So you're speaking exactly to like my biggest pet peeve is that question. And I love
Yeah.
the answer. What other recommendations have you been able, now that you're pausing, because my assumption is that your field is very fast and that very frequently do you or infrequently do you get to time to like process um how you're feeling, how you're doing, all of that. With that being said, what recommendations do you give to new people in the field that want to be you?
I think, you're right. Like there is no time to really pause. You can do a horrible, tragic call and then you leave the hospital and, the nature of the business, you don't get that couple days off to, kind of be with your family and friends and, you got to go do the next call.
Right.
Um, I think, for me, I definitely like foster an environment of no shame. Like there is,
Mm,
like none of this like old school mentality of like, oh, you just gotta buck up and deal with it. Like no, it's there is no shame. Nobody, if anybody asks for help or needs help, they the people that I manage know like this is a place where that is allowed. Like if you need time, you need time. Like
mhm,
we will work with you. We have um, we have a lot of resources that we can employ sort of like on the fly.
mhm,
We partner with, there's a countywide trauma response group of therapists that are uniquely kind of um, set up to handle this. They have family that are first responders, and so they understand like
yeah.
the first responder mentality,
Mhm,
because it's like, and it's just like know yourself, like know your employees, giving
mhm,
letting them know like an open door policy, because it is not in this job, it is not the trauma that
mhm.
causes an issue. I mean, it is a cumulative trauma. It's not a post traumatic stress disorder. It's a cumulative traumatic stress disorder. You're exposed to
Mhm.
micro traumas every single day, and it's like the 40 horrible things I saw last month aren't bothering me, and it's probably not going to be the one you see tomorrow. It's going to be all of them stacked up. It's just 40 was your limit and you hit 41.
Right. Yeah. And it's like, I love that you said you and I can respond to the same case, the same situation. We're going to walk away and process it differently, and we don't know why. But some of that is identity specific, right? Like if I have myself experience this situation, my PTSD will then kind of like bucket against my VT. As a parent, are there things, I mean, I've seen this all over TikTok where like doctors and others give advice and say, because of these things, I will not let my kids do these. Um, as a parent, have you evolved any of your parenting, or is there anything that you're like, because I've returned to these calls so many times, I will not do this, or I will not let my kids do this? Do you have
Oh yeah,
anything like that?
yeah, for sure. Like those electric like e-bikes. I'm not
Oh,
so much against e-bikes, but like I will never let my kids ride an e-scooter. Those things are death machines.
yeah,
I mean, there's like so many things that I won't let them do, because I like I know what happens. I
yeah, the
know that these
risks.
trampolines are a tough one.
Yeah.
Trampolines are a lot of fun, but definitely seen some pretty gnarly leg injuries on trampolines. like skating or hockey, if they were like wanted to play hockey, like you're not playing hockey without wearing,
Yeah.
one of those Kevlar neck guards.
Mhm.
I don't care if you're just biking around the driveway, put a helmet on, like, kind of those types of things, the car seats, like, and like where they can sit in a car, like you are, I'm old enough, and so and so's parents let them sit in the front seat. I'm like, I don't
Yeah.
care. Like, dude,
Right.
that's great.
Yeah,
Like,
that parent doesn't see what I see, and no shade to them. It's just this is part of your DNA now, is these lived experiences have crafted how you see the world. I'm probably every time that you see a motorist on the road without a helmet, you kind of cringe. Is that
yeah,
fair
I
to
mean,
say?
I do, because it doesn't take a lot, you
Yeah,
know. You could just fall over on your bike, and if there's a curb right there, you don't put your hands out, like, and your melon hits the ground, like
right.
that could be a life altering.
Right. And it's not really worth it for what, not wearing the helmet. Is there any other, I don't want to say hypervigilance, but any other quirk? I said that one of the quirks about law enforcement that I work with, they always have to sit facing the exit and the entrance of a restaurant. Like that is just in their DNA. That is not a control thing, that is a comfort thing. And is there anything like that about you now that because of what you've seen, you have a quirk like that?
I mean, I can definitely eat food faster than pretty much anybody. Like the
Because of
the
that
two,
hustle?
yeah, like the two things that cause the most anxiety is like paying for food that you haven't gotten yet, because you're like, especially if you work in like an urban system, like I used to, it's like you're busy, you're running. I think the other thing too that's definitely is like intuitiveness, like that, like I can look at people and you know like a you know for right or wrong, like that quick judgment of like basically who they are, like this person is a you know not to be blunt, like this person is a drunk, or this person is mentally unstable, and it's just like those quick, because you're just constantly exposed,
Yeah.
especially like if you have an urban system with a large homeless population. um those quick judgments. We actually had, we used to have FBI agents that would ride with us,
Hmm.
if they were paramedics as well, and me and my partner were just like sitting there, like, calling out names. And I guess they had said that, like, they look for people like us as like profilers if there's like a big crowd, because like generally we're kind of correct on that.
Yeah.
So you have that like kind of have that like that intuitiveness, and definitely like a we always say, BSI, body, make gloves, body, and scene safety.
Yeah.
So like, while maybe not sitting next to, like, the door is not as big of a thing, as I'm not in law enforcement, but like I will look at every single person in the room, and
Hmm.
like, and make an inventory of everybody that's in there.
Yeah. So the only example that I can think of in my world was that when I was running a facility in the residence halls, I could tell you which, work orders need to be put in because your mind just scans to like that part of this is part of my job. So you're going to environments and you're scanning for like all the health concerns and you're doing the profiling, which is really analysis of behaviors. And you're making sure that you're constantly in a safe space because you always have to be on.
Yep.
Is there anything that you do that helps you to be off when you're actually off? What do you do for your self-care?
So that's like this question that I've struggled with for a long time, because it's like, and cops, firefighters, people in EMS, it's like, is it ever off?
Yeah.
Not to like, talk ill of our banking industry, but like, if I'm a bank teller
Hmm.
from 9 to 5, when I leave, I am no longer a bank teller.
Great.
Like, I can't imagine a situation where I'm going to run into somebody who's like, we need a bank teller.
Hmm.
However, like, if I punch out of work and I am in a grocery store getting dinner,
Hmm.
and somebody, collapses in front of me, like, I'm still a paramedic. It's like one of those
Yeah.
careers that's like, you are the thing
Hmm.
even when you're not, and you'll never not be. And it is, in order to be really good at or at least like in my opinion, to be good at doing what you do, you have to be able to like disassociate from what you're seeing, and it's like this weird dichotomy that you have because I was one of the phrases that I always like took to heart, which was when somebody I respected very much, who was my initial instructor. They said, "Never forget the humanity of the people you're dealing with,"
Mm.
which I really took to heart. But at the same time, like you almost have to like develop an empathy disorder to do this job because I can't go into a situation where they're like, I in order to function well, and like my heart rate doesn't go up anymore. I don't sweat on calls. Like I'm
Hmm.
completely calm.
Hmm.
Like I'm talking with you and everybody else could be freaking out. And so it's, the concern is that like I feel like I turn it off, but if something really tragic were to happen to my kids, it's like who's going to show up? Is it going to
Yeah,
be Colin the father or Colin the paramedic? Because they're very different people, you
for
know.
sure. And I
Um,
think it's so interesting too, because one of the feedback that I get from other practitioners is they say, "Oh, I don't get vicarious trauma." And then I challenge them in a playful way, but I'm like, it's physically impossible to be in a helping professional and not get vicarious trauma. Now, it might not come out like you're sobbing or you're angry or you're managing it, but there's no way for you to help and see people at their worst days and not take some of that home. And it sounds like you're saying that you agree with that. It's just the magnitude of how you let that impact you day to day. You've learned how to compartmentalize it.
I think for the most part, like I mean, I've definitely done a lot of work on myself to like get to that point. It was not
Mhm.
always the case. Because you're right, like there's no way that you can see this stuff and like it not affect you unless you have like, diagnosis of
Uh,
psychopathy or
right.
sociopathy,
And I say that
which
all the time. Unless
which
you're
might
a sociopath, I don't know how you can't care about somebody else that you're paid to care for, right? Like,
right, which like, when I tell my therapist, like, I think I'm a sociopath, she's like, you're not. I'm like, why? Because sociopaths don't care if they're sociopaths. Like,
exactly.
if this
Yeah.
bothers you, I'm like,
Right.
okay. Um, so yeah, I mean, it's like you definitely that you definitely take that stuff home with you.
Hmm.
You know, it doesn't go away. Like you can't unsee what you've seen. You can't, I like the idea of, people want to heal the trauma, and it's like, well, I don't. It's like part of me thinks like you really can't. You
Hmm.
have to live with it and through it. If I break my arm, it doesn't matter how good you make my leg feel.
Yeah.
Like I still broke my arm. You
Right.
can't take away the break.
No
You
different than
know,
the grieving process. It's a process, right?
right?
Like, and there's no pill that makes us speed it through quicker just because that's what we want.
Yep.
I love hearing so much of your wisdom and everything that you've learned, that everyone who is listening to this will feel what you've gone through and will normalize what they're feeling. And I really appreciate that. And I also want them to hear that it's not all doom and gloom, that there is this other side, and that every call that someone is returning to and supporting, that it is all worth it, and that you kind of have to check in with yourself to make sure that you aren't burnt out because you have to be the priority.
Yeah. I think like as I've gone through this journey in this type of field, I think for me, like I think a lot of what leads to, the burnout and, which in my, which is like the trauma that you see and just taking over, it's not
Yeah.
really burnout. I think, building that resiliency, I think there's a big educational component that comes to that. And it's like, again, I don't know if the Dunning-Kruger effect would be the right thing to look at for that, but it's like, if you are doing something that you might not be competent in and might not have the confidence in, it's like you become a paramedic, we assume that you know what you're going to do, and like you're just going to do it, and over time you're just going to get better because experience
Hmm.
is what makes you get better, which in my opinion, experience is a four-letter word. I've seen people doing this terribly for 30 years and people doing it amazing for 3 months.
Right.
But I see the people that they get thrown out there, and it's like you have this thing you have to do, and then they don't know what they're doing, and there's a bad outcome and they think it's their fault and they can't get the education
Mm.
or they don't know how to get the education or nobody thinks that they need it because they have this title with their name and like that just that repeatedly happens so you're just constantly like any resiliency you built up is completely getting taken down because you're running into situations where you think I'm going to mess up, I'm going to mess up, and I like that I think is very mentally taxing.
Yeah.
And that's what you see these people that are like, oh, I did it for a few years and then it was just not for me, I got burnt out. It's like I think that that component as well is pretty big.
Right. Before we end, I always ask the participants if they have a mantra, a quote, something to spill the beans and end the episode on that. Do you have any sage thing that you say to yourself all the time or that you say to other people to get you through?
um yeah, I definitely, I mean, for me, and the people that I manage, it's like a very, I guess I would say, simple rules. If you work for me, you know do your job, be nice. um if something is like, if something is worth doing, it's worth doing right. Like, or when given the opportunity to do the right thing, do the right thing. And don't forget the gravity and the effect that you have on other people. Like, you have somebody's life in your hand, and it's their emergency, not yours. I
It's
think those
all
are kind
very
of the
helpful reflections. We
yeah.
so appreciate it. Well, thank you for joining us on today's episode of Spill the Beans. Thank you all for watching. Hi, everyone. Thank you for watching today's episode, which is dedicated to our beloved EMT, EMS, first responders. I really appreciate you taking the time to watch this and hear about what happens behind the scenes when you make that 911 call or that when we're struggling, and this is the individuals that show up for us. One of the things I learned from my cousin today is how aligned the things I talk about in my workshop are with what he's experiencing. More specifically, I talk about how vicarious trauma, secondary trauma, when it becomes toxic and unmanageable, leads to burnout. And he echoed that. He also echoed that this is part of who he is, right? That this is not something that he can just not be. He normalized even when he's in the grocery store. If someone is in distress, he has to respond, not just ethically, but morally and kind of organically, he would respond. I think we need to acknowledge that they're really never off. And so, what does that look like for you in your helping profession or how to support someone in the helping profession? I would love to continue these conversations. I think it just reaffirms that what I'm doing here, even if I'm only talking to 12 people, it's so beneficial for me. And I hope that we can continue to grow as a community talking about the byproduct of these professions because it's so important that you feel supported and that you know that you're cared for. I really appreciate everyone that has ever supported me when I'm in need. And if there is anything that I can do to give back in the way of saying that you are heard, you are validated, and your vicarious trauma because you helped me is really important. And I thank you. So, with that, I leave this episode with a lot of gratitude. Bye bye.